Hello everyone, my name is Alissa Dan, certified massage therapist and health educator, structural relief therapist, and level 3 advanced neurokinetic therapist. I am the owner of Empowered Living Advanced Body Therapy, Sonoma County Family Alternative Health and Wellness. Tonight we are going to be talking about ways that you can move well through pregnancy, whether that is before conception, throughout pregnancy, labor and delivery, and after birth, even up to many years down the road from when you do give birth. There's no time limit on this. So we've all heard how pelvic floor strength is important for bladder control, intimacy, pregnancy, and most people don't tend to know directly how to properly engage their pelvic floor so that their baby can be born. Many pregnant women have heard that when you're pushing, you almost have to act like you're having a movement, and that can be very odd for women, though in most ways it's actually true. So most of the time, people in general are more engaged in the front of the pelvic floor than in the back of the pelvic floor. When you aren't engaged in the back of the pelvic floor, that can cause anything from longer labors and deliveries to more painful back labor because the back of the pelvic floor doesn't engage enough to bring baby's head back to center in order to be born effectively. If a woman is too engaged in the back, though, and doesn't engage the pelvic floor in the front, that can cause pain and pressure in the front of the pelvis or pubic symphysis area. So we need to be able to feel how to push and engage our pelvic floor evenly, the front and the back, in order to properly allow our baby to be born. If we don't have that, then sometimes there can be more complications, longer labor, and other situations can happen in the moment if we are not prepared and understand what is going on. Tonight we will be going over great complete exercises to do every day to strengthen and even out your pelvic floor, specifically in preparation for conception, labor and delivery, pregnancy, after pregnancy, but mostly labor and delivery. So items you can use around the house are 2 tennis balls, 4 bouncy balls, a 5-inch ball. Here's a 5-inch ball. Here's a couple of tennis balls. And you can even use 4 like bouncy balls to go around openings and things like that to help the pelvic floor, specifically around the openings and such. But for tonight, we're just going to be doing the tennis balls and the 5-inch ball, or a rolled up towel that's comfortable to hold between your knees. So, and in between doing these movements, sitting on a fitness ball can be a good suggestion for adding to the momentum of these motions. So of course, if anything doesn't feel right, pause, try again, try a modification, try again later, stop altogether and reach out, and we can walk through a specific sequence for your situation. And you can call and text me 707-536-1147, or by emailing me at Alissa, ALISSA, at empoweredlivingmassage.com. So now let's get started. So sitting, you want to sit in a comfortable chair or sofa on the 2 tennis balls so that you could sit on them relaxing easily for 15 to 20 minutes. And make sure they're even, and then occasionally squeezing your glutes together to keep good proprioception with that area. So this is so important for getting your pelvic floor engaged and prepped for delivering your baby efficiently and effectively throughout your labor. So first we are going to be starting with breath and squeezing our glutes. So squeeze your glutes against the tennis balls, breathe in and breathe out, and relax your glutes. Squeeze your glutes against the tennis balls, breathe in, breathe out, and relax your glutes. Now we're going to add the pelvic floor. Your pelvic floor needs to move through a Kegel evenly, both the front and the back. When we breathe in, our pelvic floor diaphragm moves down, and when we breathe out, our pelvic floor diaphragm moves up. So we're going to move through that with breath and engage our glutes in the next level. So breathe in and press your pelvic floor down evenly, the front and the back. Breathe out, pull your pelvic floor up evenly, the front and the back. Breathe in, press your pelvic floor down evenly, the front and the back. Breathe out, pull your pelvic floor up evenly, the front and the back. Bring your pelvic floor back to neutral in the middle and breathe normally. So the good thing about this is by doing these movements up and down and then always coming back to neutral, that allows our pelvic floor to go completely down and completely up and come back to neutral and not get stuck in a prolapse position or stuck in a too tight of a position. So always going down fully, coming up fully, and then coming back to neutral brings your pelvic floor into alignment and doesn't cause too much tightening or too much loosening. So now we're going to add our glutes. So squeeze your glutes together and hold against the tennis balls through this entire sequence if you can. So squeezing together, breathe in, press your pelvic floor down evenly, front and the back. Breathe out, pull your pelvic floor up evenly, the front and the back. Breathe in, press your pelvic floor down evenly, the front and the back. Breathe out, pull your pelvic floor up evenly, the front and the back. And bring your pelvic floor back to neutral. Breathe normally, and now relax your glutes. So we're going to do that again. So squeeze your glutes together against the tennis balls evenly. Then breathe in and press your pelvic floor, Kegel down evenly, the front and the back. Breathe out, pull your pelvic floor up evenly, the front and the back. Breathe in, press your pelvic floor down evenly, the front and the back. Breathe out, pull your pelvic floor up evenly, the front and the back. Bring your pelvic floor back to neutral. Breathe normally and relax your glutes. So this is really good for getting that full Kegel with the pelvic floor, and then also engaging your glutes so that your glutes engage really well in order to stabilize your low back and keep you engaged with your baby as they grow, he or she grows and gets closer to labor and delivery. So now we're going to add the front of the pelvic floor to add a little bit more muscle activation and complete the sequence. So you want to take your 5-inch ball or rolled up towel and hold it between your knees just so that you don't drop the ball. So you don't want to squeeze your knees together too hard. This just stabilizes the entire pelvic floor, the entire pubic symphysis, so that you get the entire front and the back stabilized, and we'll go through a mini sequence this way as well. So now while holding the 5-inch ball between your knees, squeeze your glutes together, draw your pelvic floor up evenly, the front and the back. Breathe in, breathe out normally, and hold for 1, 2, 3, 4, 5, 6, 7. Relax the Kegel down the front and the back. Relax your glutes and relax your knees in front. Hold the ball. So now we'll do that again. So what we're doing is we're just breathing normally through this. We're not using the breath with the Kegel. We're just breathing normally and moving through these sequences while holding the Kegel up in the higher position so that it helps to hold our pelvic floor, tighten our pelvic floor in a good way, hold the baby in, and also to help with leaking, help with the ligaments not get too lax throughout pregnancy. So now we're going to hold the 5-inch ball between your knees, squeeze your glutes together, Draw your pelvic floor up evenly as high as you can go, the front and the back evenly, and breathe in and breathe out normally, and hold this position for 1, 2, 3, 4, 5, 6, 7. Relax the Kegel and relax your glutes, relax your knees. So this helps the whole pelvic floor consistently hold everything in place as your glutes and hips even out. So doing these sequences several times every day helps your body to get more used to engaging your hips, which stabilizes your low back, increases circulation throughout your pelvic area for you and your baby. It releases pressure on the pubic bone and evens everything out for the both of you. Helps baby too. So you can even do these sequences when you are standing, opening up your pelvic area and doing the sequence on a fitness ball, and throughout your days to prepare you for pregnancy, help keep your pelvis engaged throughout your whole pregnancy, help you move through labor and delivery effectively and efficiently. And even after birth, these movements allow you to regain the elasticity of your pelvic floor with less prolapse, leaking, and can help improve intimacy again at a quicker rate than it would otherwise. So first we start with the Kegels and the breath, and that ends up moving through these sequences to help you when you are actually in labor and delivery and can't necessarily think straight. I've had 2 natural labor and deliveries myself, and so I know what this takes, and I know what is possible to have an efficient and effective labor and delivery. And I've assisted births, I've assisted live, as well. So there are a lot of options, and if you need a resource, I'm here to talk to. So if you do have any questions, like I said earlier in the video, you can call or text 707-536-1147 or email me, Alissa, ALISSA, @empoweredlivingmassage.com. If you're in the area of Sonoma County, California, you're welcome to come by my office for a visit. And we can check what muscle patterns are actually on and engaged and help these movements work even more efficiently for you to strengthen your pelvic floor and move you forward throughout your pregnancy for you, your family, and your little one. So congratulations, and like I said, if you have any questions, feel free to reach out. I will talk with you later. Have a good evening.